Hi, I'm Tim Williams. I'm the lead litigation attorney here at the firm. In this video segment, I'd like to talk about rotator cuff injury and repair. So in this diagram here, you can see we're looking at the shoulder. This happens to be the left shoulder of this individual. And we can rotate this around and look at the various angles of the shoulder. What's useful for this conversation is actually go through and take away some of the skin and then some of the musculature. And you can see now, we're still looking at the front of the shoulder. I've just taken some of that skin and muscles away. And we're going to rotate it around. And you can see here at the back, we have one set of muscles coming in, attaching to the shoulder just underneath that surface there. And we have another set of muscles coming in, attaching more to the lower side of the shoulder. And this area is referred to as your rotator cuff. There's many ligaments that comprise of that. There's three main ones, and we're looking at two of the three currently. In addition, you have your bicep tendon that comes up and through and connects as well, but we're not going to talk about that for the purposes of this conversation anyways. But let's assume that there's a rotator cuff tear. We're going to look at this top tendon that comes down and attaches there at the top. That's the most commonly torn location, and we're going to talk about how a doctor or a surgeon would go about fixing that. Whenever you have a complete rotator cuff tear, assuming you're relatively young, you're active, you enjoy hobbies, you do any sort of lifting overhead, the doctors are likely going to go in and repair that. So thankfully we have a video that can walk us through this. So again, there's the shoulder. The surgeon would then cut a couple of what are called portholes, just meaning locations through the skin that they can put their instruments and their tools to do the work underneath the skin. This is an arthroscopic repair. So you see there's three portholes that were cut. Then they're going to insert first a camera with a light on it so they can see what they're doing inside. They can visualize it. And we'll pause this for a second. And you can see, remember that tendon I said came in and inserted right there or attached right there? That's where a tear is. And you can see it's a complete tear, meaning the entire surface is torn away from the bone itself. So this is a complete rotator cuff tear repair. So then through the other two portholes, they insert these tubes through which they can insert tools, because they're going to use a couple different tools. The first one here, what you're seeing is they're using the shaver, and they're actually what's called debriding, or taking away tissue, that frayed and deadening tissue. They're taking that all that away to create not only a smooth surface, but also to rough up the blood vessels and to promote healing. So they want to open it up a bit to create the healing response from the body, so that it would try to heal, particularly after they do the next steps. So through those ports now, they're inserting different tools. They're actually punching holes into the bone itself. This is the top of your shoulder here. This is your arm bone or your humerus where it connects to the shoulder. So they put a couple holes into the humerus. Then after that, they're going to insert a drill, and so they punch it first, and they're going to drill it to clean it out next. So you see they're drilling the first hole, and now they're going to drill the second hole here in a second. So now we have two nice clean holes that they can now use the next step in. So they have this screw-like. Hold on for a second there. So they're now, if you think of a drywall anchor, that's kind of what this next step is like. So they have this screw type, like we've seen the drywall anchors that you screw into the wall. That's pretty much what this is. And they have this piece of material with the screw tip, and they're now screwing it into these holes they just drilled into the bone. So there's the first one, and you can see on the back side of those anchors, there's string or suture material. Now, through those same tubes, they're going to insert two different tools. And these are what are used to grab the suture material, and then you'll see here in a second, they're going to move it over. They're going to punch it through the end of that tendon. This other tool is going to grab the part that's been punched through and pull it. And that way they can then tie the knots. So we're going to do that with all the material. Fast forward through that. And now they've pulled it tight. They've tied their knots. They're going to clip the ends off, the extra suture material off. So then you have your rotator cuff tendon has now been pulled back into position by the use of these sutures. So here they go clipping the other side off, so now it's nice and tight and tidy. So that is, it's now in a position, it's been cleaned, the body's healing response has been instigated because of that debridement procedure. And now what they do is they close up those portholes and your body healing process begins. It heals in such a way that it actually reattaches, it secures that tendon back to the bone itself. And it's not just the sutures holding that into place, but it's actually the tendon that's now healed to the bone. The idea there being to bring back 100% or near 100% of functionality that the person once had before they tore it. So that is in a nutshell what a rotator cuff tear looks like and the surgical approach to repairing that condition.
If you've been injured and need help, Dwyer Williams Churkos attorneys will get you the settlement you deserve. Experience gets results.